Welcome to this year's Continuous Professional Development Workshop being organized by Pali, Passionate Africa Leadership Institute. I am a professional banker. I'm also a career counselor and a corporate trainer. And I also do workshop facilitation. I have done this for well over 20 to 25 years. Well, good day, fellow allied health professionals. And today we want to look at reflective practice and ethical decision making. So we critically want to see if reflective practice can help you and I in our case decision making, in challenging situations at our workplace, at various times where we have to take key decisions. And we want to see if there's any relevance between reflective practice, ethics, and decision making. And so we will proceed from there. We believe that reflective practice can actually help us better make decisions. Decisions in dilemmas, in tricky situations, case studies, medical situations, so that we can improve on our decision making and also maintain a strong level of ethics. And so today we would want to, once again, the theme for the whole period is the reflective practice and audit of services. As we know, the audit of services is self-checking, checking the services that we provide to patients and checking whether we are doing the right thing, whether we are improving ourselves, and whether we are generally improving the clinical outcome for our patients and for the institute or the institution that we work with. And so our topic, reflective practice and ethical decision making. And so what will be our objectives? One, we want to provide participants with a working understanding of the ethical values required in health work environment, specifically allied health practices. And then also want to sharpen our appreciation of important relation between decision making and ethical behavior. It is important because we are dealing with lives, and a decision can make the difference between a patient dying and a patient living. It can make a big difference between a patient being permanently disabled and a patient recovering very quickly. And then we also want to therefore enhance all of us our capacity and ability to use reflective practice in making ethical decisions when we find ourselves in challenging situations. Okay, so we roll. And as usual, we want to have this visual look at the many professions that are captured under allied health in Ghana, and putting on record that all these professions are very important, very critical. In many, or indeed in most cases, a number of these allied health professions work together, work as a team to solve very challenging medical or health cases. And so we have all of you, and we salute the allied health professionals. So going forward, the key words that we would want to continuously keep in our minds: reflective practice, reflective practice, reflective practice, ethics and morals, and then decision making. And all in the context of allied health profession. And so the question then we begin with ethics and moral. And the issue is fundamentally the issue or the question of right or wrong. So that in every situation we find ourselves, the critical issue is that what decision we are taking, is it right or wrong? And the essence of reflecting on it would help that when such situations come up again, we will be able to decide on a quicker note what to do under such circumstances. So the issue of ethics and moral, right or wrong, and that should be stressed. So then the question then begs is then, what is ethics? And so if we look at the dictionary definition, it says moral principles that govern a person's behavior. So the word moral comes in. Ethics, moral principles that govern a person's behavior or the conducting of activities. And then we want to also say that going out of the dictionary, ethics has a balance of decision making. And as you can see from the picture here, one side of the weight is low or lower than the other side. And so that captures or encapsulates what we mean by ethics. Because right would be the better thing to take as against a wrong. But sometimes the issue becomes, in decision making, what is right and what is wrong. And so we then want to see that in that case, what do we say is ethics? And as we said, it is difficult to define ethics in precise terms. But in a general sense, ethics is a code of moral principles and values, that govern the behavior of a person or group with respect to what is right or wrong. So there is a certain code, there is a certain putting together of actions that we can classify as a group as right or wrong. And so in the context of allied health professionals, what is right should be quite cutting across for allied health professionals. And in the context of allied health professionals, what is wrong should also be wrong. And then when it's coded that way, it becomes the ethics of the profession. So that is it. And so trying to distinguish again right from wrong, that is the key thing. What is right, what is wrong? At every moment, that is the decision that has to be taken. And in your practice, every day, there are so many instances where decisions have to be taken, challenging decisions, and the issue is that, is it right or wrong? Morally right or wrong? And in the context of the allied health profession, is it ethical? And so that is the difference. When we look at the issue of moral in common speech, it simply means what is good or right on one hand, and what is appropriate, good, right, or appropriate, and then what is not, what is bad. So moral can, in a broad sense, can pertain to beliefs as well. So when we talk of moral, then we have immoral and amoral or amoral. So when we say immoral, then we mean bad, wrong, or inappropriate. But it also denotes in evil terms somebody who doesn't care. Somebody who knows the difference between right and wrong, but does not care. Then it means the person is immoral. Then separate it from the one who is amoral or immoral. And that one, like a psychopath, somebody who has no sense of right or wrong and is just out there killing people, or like a fish in the water. Technically, no sense of right or wrong. And that is what we mean by immoral. So we have moral, immoral, and then immoral. And so in the context of ethics, let's look at this picture. And now we are going to look at elements that come under ethics and morality. So we would have to now look at being accountable. In other words, whatever you do as an allied health professional, you have to be accountable. You have to work on principles, not according to your whims and caprices, not according to how you are feeling today. If you feel good today, you take a certain decision. If you don't feel good tomorrow, you take a certain decision. That will not be ethical. So you have to work on accountability, that you need to report to some other people, superior or not. You need to work on principles. You need to work with integrity and to work on integrity. And you need to work on core personal values as well as core institutional values. And so look at the picture, and these are the elements that I want us all to take a piece of paper and start noting. Accountability, working with principles, working with integrity, and working with values. So look at this, another picture, ethics and morality. What do you think? On the left side, what do we have? Ethics. On the right side, morality. And in the middle, we have right and wrong conduct. So that is the overlap, right and wrong conduct. And so on the right, we have morals. So morals then become your personal principles of what is wrong or what is right. And it rarely changes because this is you. That is what you believe in. But in the context of a bigger group, such as the physiotherapists, such as the mental health group, such as allied health professionals altogether, such as the medical or health field together, then what is right or wrong can be it's agreed upon, and then in some cases becomes a code of ethics. And that is the difference between morals and ethics. So ethics then become for external use on a group level, on a team level, and may vary between various environments. And so that is noted. Another good picture that shows the essence of ethics. And again, I want you to take a piece of paper, and every day from today, every moment, these are the questions that we need to be asking ourselves under ethical behavior, particularly as allied health professionals. You know, when you are in a dilemma, what do you do? Do you take the easiest path out? Do you take the selfish path? What do you do? What values do you have? Do you stand for right as against wrong? Will you stand always for right as against wrong? Or you stand for right only when it is not your family member? But when it's your family member, you then will say the wrong is right. These are the questions that are underlining the key issues of ethics and morals. Does it benefit you? So if it benefits you, then you go along with the wrong. If it doesn't benefit you, then you say no. What choices do we make? What choices do we make in critical health situations? And so these are the issues that I want us to always take note. Compliance. Do we comply with what is stated to be the right thing to do under a certain circumstance? Or we need external influence to comply? These are the issues that you will have to continuously look at. And so, I want to ask you a few interesting questions. True or false? So, the following statements, true or false? Ethics has to do with my religious beliefs. True or false? Can you answer that? Answer that on your own. Okay? So this is what we think. Yes, it's true. Ethics, it can be linked to religious beliefs. But remember, it is much more than religious beliefs. Because in some cases, what would be ethically right in one religion would not be ethically right in another religion. So yes, it is linked to religious beliefs, but remember, it is much more than that. Let's look at another question. What do you think? Ethics, it has to do with whether my feelings are right or wrong. And that's the question I asked earlier on. If today you are angry, would that change your decision in a similar situation at your workplace, at the hospital, at the medical center, at the chief's compound? Will your decision on a patient be different today because of your feelings? So has ethics got to do with your feelings? Whether my feelings are right or wrong? Well, we think that it is true. But if you have a feeling that this is wrong, it is worth looking at that. But we must realize that sometimes our feelings can cover or cloud our judgment. And that's what we said. If you let your feelings lead you in this critical profession that we find ourselves, allied health profession, if you let your feelings cloud or cover your judgment, it will make it difficult for you to see both sides of an issue and be able to take a reflective and ethical decision on a matter. And that's why we said when we practice reflective processes, when you practice reflection, then you have a certain sense of documented approach, which means that no matter how you are feeling on a particular day, because you have done reflective practice, you know the right ethical answer or the right ethical way to do with the patient at that particular time. So that is it. Let's look at a couple more of the such questions. Being ethical, has it got anything to do with what the law requires? What's the link between ethical and the law? Well, we think that, again, it is true. People and businesses have to follow the law. Following the law in general is an ethical process. But remember that sometimes the law itself may be unethical. Sometimes the law itself may be unethical. And so, again, let's ask another one. Ethics consists of standards of behavior as society expects. Again, what do you think? Take time. Note your thoughts on this. Ethics consists of the standards of behavior that society expects from us. And yes, so societies can have their ways that that particular society thinks is right or wrong, and therefore becomes the ethics of that profession or society or community. But what we say, yes, but again and again, remember that society is sometimes unpredictable and sometimes can become very, very cruel. And if you look at the places where there are lots of conflicts, in Russia and Ukraine, in the Gaza Strip, even in Ghana, you know, where there are so many tribal conflicts, then the expected behavior of the people of the area, let's say we are fighting, so our expected behavior is to attack a certain group. But then the question is that, then at that time society becomes unpredictable and cruel. And so these are some of the issues. So therefore, having gotten a good understanding of ethics and moral, and seeing so many underlying issues that come under ethics in terms of principles, in terms of what is right or wrong, you know, in terms of your values and so on and so forth, that is settled. So now let's begin to move into our actual work and the relevance of ethics. And so the question then we can initially ask is that, so ethics, as we have seen it, what is its relevance in a workplace? What is institutional ethics? What is workplace ethics? And so we see that workplace ethics are basically the policies. Listen very carefully. The policies and practices regarding potential controversial issues, such as a decision for a particular situation, such as What do we do with inside information, such as confidentiality, such as discriminating between the sexes or between religion, etc., such as patient responsibility as against the responsibility of us as health professionals, such as the issue of trust. Can the family trust in us to give us damaging information that will be helpful to the patients? So these are all things that come together, and they are put in a workplace under ethical codes, or as we call it, code of ethics. And so in that case, having dealt with workplace ethics, let's move it a bit further inward and see, therefore, particularly zooming in on health care.
Thank you. 31.
34. So halfway. Yes, so as we're saying, we have things, already existing cases, issues like case conference, where a number of different allied health professionals or even medical professionals, including doctors, nurses, etc., come together to assess and clinically look at particular cases with the objective of making a collective decisions that will be the best under the circumstances. And we have other things like the clinical trials, and I'm sure we are all conversant with these two case conferences, which we are all involved in, and clinical trials where certain levels of trials are done to see how effective a new drug or a new way of healing is at various levels. Now the point is that case conferences and clinical trials also involve releasing or using information about patients, about our patients. But then they have been legitimized by the intentions behind case conference and clinical trials. They have been legitimized that the intentions is to improve training and is to improve the practice. So with those where the patient's confidential information is used in case conference or clinical trials, it is more or less accepted that it is regulated, and so it is okay. But it is not so, at least for now, when you come to reflective practice. Because with a reflective practice, you are documenting not as a case, but to improve yourself. So is it right for you then, as an individual, to have the details of the patient? And that is where the moral issue about reflective practice and the ethical issues come about. So reflective practice is not simply just re-examining someone's case, as sometimes it is with the clinical trials and case conference. It involves your personal interpretation and judgment. So you, the reflector, you may be recording incidents verbally or in written form, which you would otherwise not be recorded. But because you are doing reflective practice, you record. And this may become controversial. And this is where the ethics comes into play. So this raises questions about the nature and ownership of the knowledge and the responsibilities. And so this is the first part of the issue of ethics. And so whilst reflective practice may prove to be a good thing, we have seen that it cannot be done in isolation from ethical concerns. And that is why we want to see what is the way forward. How do we now, under the situations, go ahead with reflective practice and yet be able to be ethically correct? We'll look at various things or issues, and then we'll present you with some case studies for you to go and try. And so what we say is that in public health, when you're acting ethically and fulfilling all obligations to the public, it requires careful reflection and intentional decision making. And in order to do so, you and I, as public health workers, as allied health professionals, we should have the capabilities necessary to cope and decide on what is ethically correct, particularly when we are under pressure presented by certain cases. Face to face, we are in the middle of it. What do we do? And how do we use reflective practice And we said reflective practice will help you to document actions that would help you to improve decision making anytime the same issue comes back. So you would have documented the best way forward. And so, to look at that, we say that, so what is reflective decision making? And we want to go forward and say that it can make you make better decisions. It will help you to step out of just thinking about the outcome and rather concentrating on certain issues which we are going to look at. And this is an area that we have to carefully look at. There are some important aspects of a decision that if we pay attention to, we'll be able to look at cases and take ethically correct decisions. And so, what are these issues? And I want us to pause here and ask yourself, as I'm asking myself also, all of us as allied health professionals, ask, when you are taking the decision, do you just want an outcome? So the outcome is what is important to you, or you want to consider the following? And we are suggesting that in going forward, under this reflective decision making, these are issues that we should consider. And when we do consider them, we will be able to take very good decisions. In addition to what we had earlier on referred to in terms of, being just, being under fidelity, and so on and so forth. So let's take them one by one. Now, each of these that we have outlined, the facts. Do you look at the facts? Do you look at, are you aware of the situation? You should. You should look at the facts. Do you strive to get complete information before taking a decision? Are you biased? Are you only interested in the outcome? And each of these impact every decision we make. But how often do we stop to consider them before we decide what to do? How often? Let's ask ourselves. Let's be sincere. So we just act most of the time on the spur, on the springs and caprices of our emotions, of who it is. If it's our family member, different action. If it's not somebody that you don't know, different action. And this is where reflective practice, reflective decision making comes in. So the outcome should not be irrelevant. Your emphasis should not be on the outcome. If the process of decision making is correct, the outcome will be correct. Rather than seeking, this is the outcome I want, and taking any decision without thinking through these various aspects. So what matters is what you knew and what you didn't know before you decided. So this is it. Let's take them one by one, even as we bring our session to a close. So let's look at the facts first. So these are the issues that, when you're looking at the facts of the case, the dilemma, the situation, the conundrum, the challenge, where you have to take decision, and your decision should be ethical. And we are recommending reflective decision making. This is the first element, the facts. What were the facts before you took your decision? Ask yourself what you knew to be true. Don't embellish it, don't add sugar, don't sugarcoat it. Tell it as it was or as it is. What were the facts before you took your decision? What were the facts? Did you assume the information as facts? Or did you cross-check? Did you assume, as often happens, that that information you have is the fact? What were the facts before you took your decision? Number 2, you have to be aware of the situation. What were the circumstances for the decision? Were you influenced by the doctor? Were you being influenced by your superior? Were you being influenced by your feelings? Anyone influencing you? How did you feel about the situation? What were the circumstances, the situational issues? Were you aware of the situation after the facts? When you reflect on situational awareness, it means taking a look at the situation from above. Don't put yourself involved. Don't be involved. Look like what we call the helicopter. Take the helicopter pilot view and separate your emotions and capture the emotions that were around. Were you influenced? Those are the questions. So take, as we said, the helicopter pilot position. Helicopter pilot position is be above the situation and look down and document. When you do that, you do it devoid of emotions. And it opens up blind spots. If you are down, you will not see. You call it blind spots. And these are the parts of the situation you can't see when you are in the middle. So separate yourself by going up above, and record the situation. Be aware of the situation. So number 1, look at the facts. Number 2, be aware of the situation. Still under number 3, be careful of incomplete information. We receive information all the time and most of them are incomplete. There's a lot that happens that we don't know about or can't see. Others might be playing a part in your decision that you don't even know. So make sure that you have all the information for you to take a reflective decision. When reflecting, you should be looking to find out this incomplete information. The remaining part of the information that will be important to your decision making. And then you learn to use that extra information when deciding what to do. Incomplete information. And then we look at your bias. This is a very serious one. So there's much to talk about it. Your bias can be your thinking. That's why you remember we talked about do not be biased because of ethnicity. So that once you have signed an oath to be in this allied health field, then your thinking, your cognitive issues do not come in. You have to drop them. Your values, your belief systems. Because they can become flaws in your thinking and they can lead you to draw inaccurate conclusions. They can be harmful. Because because they will cause you to focus too much on some kind of information whilst overlooking other kinds of information because of your bias, your thinking bias, your values bias, your belief bias. So recognizing that I have a bias is by itself improving your ethical decision making. Because when you recognize that I have a bias, then you are able to put the bias aside and look at it based on the facts and the situations as it is. So once we accept that our decisions are affected by our bias, then we are now able to work towards minimizing their impact on our judgment. This is very important. And quickly, urgently seek to negate it before we do our decision making. And still on biases, there's one bias called negativity bias, where we pay more attention to negative things. A situation is there, the bottle is half full, but you see it as half empty. That is called negative bias. Please, colleagues, let us pay attention to that. When we pay more attention to negative rather than positive experiences, and you know we said reflective means you have to document. So if you are doing reflective practice and you pay attention to the negative, then what you are going to do, you are going to be documenting only the negatives. But we said document the positives also to help you improve and to help you make you better. So negativity bias means that setbacks have greater significance on our happiness than any positive experiences. So positive experiences, you don't take note of it. Setbacks is what you highlight. That is called negativity bias, and it doesn't help under reflective decision making. And when you are in a professional environment, you are more likely to remember the negative events than the positive ones. But that is not the right way to go. And so we know that not all negative biases are wrong. Some of them are correct, but that's why we said not both negative and positive. Because some of the negative is for you to survive. They become survival tools that contribute to good decision making. And so we say ethical decision making, throw away negative biases always, document both negative and positive. And then don't attach too much emotionals because it would give you a bad outcome. And so the final one, the outcomes. Now, what is outcome bias? Outcome bias is where you've already decided what the outcome is. You want to discharge the patient. So whatever you are doing, you already have that outcome bias. Your decision is based on the outcome of previous events. When Ali came, this is how it was. 3 days he was away. When Owusu came, but Owusu's constitution, his biology is different from Ali's biology. So don't let us have outcome biases. Biases based on previous events without regard to how those previous events developed. When you have outcome bias, it means you do not involve analysis of factors that lead to the previous event. And so it is a human tendency, always positive. But then that is where the challenge is, because then you become complacent when you put your mind on specific outcomes. So even in the bleak situation, people are always inclined to think that, when they do something, the outcome will turn out better. But that is not always the case, simply because you are over-optimistic. And that is what we mean by outcome bias. And see you in the next session tomorrow, where we will look at the essence of ethical decision making in the context of reflective practice. Have a very good day.